Sego sewa gwego, Sarah Youngyet. I'm a first-year student at the Ungwahue Midwives Collective Apprenticeship Program. I've created a short PowerPoint presentation about the developmental aspects of the cardiovascular system and fetal circulation. The fetal heart begins beating at the 4th week of pregnancy, but during the next 3 weeks, the heart continues to change and mature, finally becoming a 4-chambered structure capable of acting as a double pump. Nutrients and oxygen move from the mother's blood into the fetal blood, and fetal wastes move into the opposite direction as shown in the figure. As blood flows towards the heart of the fetus, most of it bypasses the immature liver through the ductus venous and enters the inferior vena cava, which carries the blood to the right atrium of the heart. The umbilical cord contains 3 blood vessels, an umbilical vein and 2 umbilical arteries. Because fetus lungs are non-functional and collapse, 3 shunts see to it that they are almost entirely bypassed. After birth, as blood stops flowing through the umbilical vessels, they become obliterated and the circulatory pattern converts to that of an adult. For congenital heart defects, environmental interferences such as maternal infections and ingested drugs during the first 3 months of pregnancy seem to be the major cause of such problems. In the absence of congenital heart problems, the heart usually functions smoothly throughout a long lifetime for most people. Homeostatic mechanisms are so effective that we rarely are aware of when the heart is working harder. The heart becomes not only a more powerful pump, but also a more effective one. An added benefit for aerobic exercise is that it clears fatty deposits from the blood vessel walls. However, let's raise a caution flag here. The once a month or once a year tennis player or snow shoveler, also known as the weekend athletes, have not built up this type of heart endurance and strength, which is why so many become victims of heart attacks. As we age, more and more signs of cardiovascular system disturbances start to appear. Gradually, loss of elasticity in the arteries leads to hypertension and hypertensive heart disease, and clogging of the vessels with fatty substances leads to coronary artery disease and stroke. Coronary artery disease, or CAD, happens when the arteries that supply blood to the heart muscle become hardened and narrow. Although the aging process itself contributes to changes in the walls of the blood vessels that can lead to stroke or myocardial infarctions, most researchers feel that diet, not aging, is the single most important contributing factor to cardiovascular disease. There is some agreement that the risk is lowered if people eat less animal fat, cholesterol, and salt. Other recommendations include avoiding stress, eliminating cigarette smoke, and taking part in regular moderate exercise programs. All information for this PowerPoint came from the 9th edition of Essentials of Human Anatomy and Physiology. Nyawa for watching. Ona.